Are you ready, Mike?
Okay. Dr. Frank, I know you've got a 1:30 hard stop. I know. We'll get you out of here before then. Hi, well, welcome back to what started as a hot talk and now is a medium warm talk, I think. I apologize for those that tried to join us live. We had anticipated being live on Facebook, but apparently we're having some technical issues for the first time ever, which is what happens in live TV. So thanks for coming back. We are filming this program so that it will be available on Facebook and also on our YouTube channel, even though it won't be live. We're hoping that we will still continue to get questions from folks that we will put to our panel. In the meantime, what we're going to do is start again, and we're going to invite our panelists one at a time to make the presentations that they had originally planned to make, beginning with Matt Carroll, who again, for the third time, I'll introduce you, Matt, just to make sure anybody new knows who you are. Matt is the Chief Economic Growth and Opportunities Officer for Cuyahoga County. He has devoted his career to public service in a variety of different capacities with the county. We are thrilled that Matt is here today to set the stage for us in terms of what's happening throughout Northeast Ohio. Matt.
Great. Thank you, Becky. Thanks to the Bar Association. It was probably better the first time, so anyway, we'll see what happens. So we hope to provide a good amount of information to you today, and for follow-up, I'd be happy to be available. My contact information is in the presentation. I'm going to cover three basic points today. One is what's happening with Cuyahoga County government. The other is just a little context setting with the pandemic in general. And then I'll try to cover economic impact as much as I can. The last few slides in my presentation have all my sources, have the links, so you'll be able to look at those articles, those things later. But just start with the next slide, the Cuyahoga County slide. Just some context for you for this. We have a total of 4,500 employees at the county, under the county executive. There are other county employees as well. But we cover a lot of sort of high priority areas. And while we are trying to close the buildings to the public and have our workers stay home and have them work from home when possible, we have a lot of functions that we have to keep doing that are really high priority. About half of our employees mentioned there are human service employees, and those functions have to continue. We can't not provide benefits and do child welfare visits and do child support. It has to keep happening. That's just, human services really is just one example. Public safety is another example of things that have to go on. And as you know, local governments have different roles. Municipal governments do certain things, county government does certain things, but they all have essential functions that have to continue to be performed, as you can guess. Under the public safety side, we obviously have our sheriff's department, we have our jail, which is a huge responsibility. It's very important that it be done well. We just started today with isolating, having the ability to isolate inmates who may be infected. We started doing a screening in the Justice Center and in the jail, and with the cooperation of the courts and the prosecutor's office and the city and a lot of partners and entities, the jail population has been greatly reduced to try to minimize the impact of this coronavirus. You're going to hear from Andrea Canast in a few minutes, who represents the county court. And again, they and others have been great partners. Other things we do at the county, of course, there are public works activities that have to continue. Other individual departments are doing important things. Consumer Affairs is communicating about scams related to the pandemic, an unfortunate element of these times. The Development Department is focused on what local businesses need and looking at some funding from the federal government that may come in. We have to keep paying bills through the Fiscal Department. We are receiving tax payments sort of as drop-offs, even though people aren't really coming into the building. Our IT department has to make sure people can work from home and the other functions of the county continue. Our county council is a key partner in making sure that we can continue to operate at some level. So just an example of the kinds of things we're doing. Public health entities, and our county public health entity is separate and independent, but has a really preeminent role in this time. They are looking at the disease as far as the individuals that have been found to be positive. They are looking at their contacts. They are advising them on how to handle it and what to do. They are working closely with our medical community. It's a key role. You'll hear from Dr. Frank in a few minutes, who has an incredible amount of experience in public health, both as an educator and as a practitioner. But again, a key role. Another key role right now for the county is coordinating emergency management. This group spends a lot of their time planning for situations like this, exercises and trainings, and this is the time that has to be implemented. They have a center that has all of the partners together in the same room, coordinating activities that cover a lot of areas. They take requests from the community, and they actually also are receiving inquiries from community. Can we help? Are there ways that we can support the effort? So they have a key role in a lot of areas. The last bullet there is the coronavirus hotline, which is a new number that's been put up for information on the issue in our county. So that's something to take advantage of. Moving to the next slide, a little bit of context on the global pandemic. The word that jumps out on this page is the word new. Public health professionals, people at the CDC, spend entire careers worrying about a new disease, a new virus such as this. And the idea is that there's a difficulty in sort of predicting what will happen from this kind of outbreak. So a lot of the work that's being done is, and the reason a pandemic exists is because of that newness. So we have had these kinds of things in the past, and they're all a little bit different. They all have a sort of an unknown element to them. But you can see there, one of the issues is that the population most likely or almost definitely does not have immunity to the disease, and that adds to the challenge. Not to mention the ongoing seasonal flu and other sorts of concerns that are more typical in any kind of environment. Next slide, more context, a little bit about the Spanish flu that I'm sure you've heard about. The example, really the worst case example of a pandemic in 1918, 1919. See the number of deaths reported. Numbers, though, is the ability to respond and what you can do. In general, pandemics since then have had reduced numbers of, reduced amounts of mortality, et cetera. But it's difficult to estimate. You'll see a lot of talk, a lot of discussion about what are the fatality rates? What do they look like? How is that affected by the number of people that are being tested? And it's a key point. I think you do your best to try to discern what are the accurate predictions and how much do we know and how much do we not know? That's really a key point. Looking at the next slide on this point, if you have some time and you want to educate yourself a little bit about the pandemic from 1918, The Great Influenza by John Barry is really an excellent coverage of that epidemic. It will probably strike some fear in your heart, but it also, I think, provides some information about it. The next slide, you'll see this week that author had a piece in the New York Times talking about where we stand in the epidemic and how important it is what we do now, how much of a difference it makes, the steps that we take. You've seen the governor of Ohio be very aggressive and very proactive in taking steps, really, I think, in many ways leading the country. And again, it makes a huge difference how we operate. I think a key point I wanted to cover on the next slide, it says sources of information. How you get your information in a situation like this is crucial. It's really difficult to know what to believe and what is the most credible sort of sources. You see from the public health perspective, obviously the CDC and the Ohio Department of Health, those two links there, those two listings there, really important. A lot of us follow social media. A lot of us look at Twitter. You will see some really intelligent takes on Twitter. You will see some very unintelligent takes on Twitter. It's really difficult to be discerning. I'd say do your best to focus on the experts, on the people that really know where they stand. If you look at the links that I have at the end of the presentation, I tried to put in some things that I thought were fairly credible on some of these issues. As far as business news goes, I'm going to get into economic impact in a second. No one source has the answer. Certainly no one source can predict these outcomes or how the financial impact is going to unfold. But do your best to locate those sources that you think are credible and be discerning. In our time now, state and local policies are probably most important because those are pretty specific. I'll just give an example. Look at this. Dr. Anthony Fauci is a preeminent expert in public health with the CDC for many years. You've seen his face probably on television quite a bit. On Sunday this past week, he did all 5 of the major morning shows, the Sunday news shows. And I followed some of the reporting of that. And on those shows, obviously, people asked him individual questions. So he answered the individual questions, and you have to really read them in total to get a sense of what the whole context is, because one question may have him give an answer that doesn't necessarily represent the entire universe. So it's, again, the only point of that is to try to be discerning, try to keep your eyes on those legitimate points. Transition quickly here to next slide about economic impact. I don't need to go into great detail on this, but just wanted to share some of the knowledge that I was able to pull up on what a recession is, how it's defined. In general, most people believe that we are going to see a recession at this point. You can see how that plays out. There's some really good information out there, and some of the links I have on context on recessions, what we saw in past recessions, past pandemics. You can see some of the how long they lasted and other situations that are listed here. You can see what economists are suggesting. A lot of people are saying the second quarter is going to be a contraction of different amounts. 10% was a high number that was listed. A lot of people saying 5-6% as a contraction in the second quarter of gross domestic product. And that's a U.S. figure, but on the next slide, you will see a estimate of a global GDP impact. You see the 2020 column basically kind of estimates the worst case, best case outcomes, and you can see what that number looks like, and that's a 2020 outcome. There's a lot more information to find there. Next slide, quick thing to see, it put in the largest daily percentage losses on Wall Street. You can see 2 of the top 5 were this month related to the coronavirus. Again, percentage losses, and you'll see a lot of coverage of this kind of data, but again, a little bit more context for you there. I wanted to transition to some local economic issues, some local economic impact data. I was on a call yesterday and discussion of service workers. Service workers are extremely hard to get. In Northeast Ohio, we have 212,000 as an estimate of service workers. About half of those are projected to be unemployed in the sector as a result of what's happened with the coronavirus. A key concern, something to keep an eye on. We will be tracking locally, our experts will be tracking unemployment claims, other metrics to kind of see how things are. Got to remember there's a data lag of a couple of months of having data be reported. I think everyone will do their best with that. People have estimated the impact of China's economy and just significant issues there. Auto industry announcement within the last couple of days of a slowdown in production, key issue. Threw in a little article about local real estate. Doesn't seem to be a huge impact right now on buyers, but sellers are behaving a little bit differently in some of their approaches. And want to kind of end on the economic development side on the hospitality industry. And you can go to the next slide, other local input. Talked to some of the hospitality leaders in Cleveland over the last couple of days. It's hard, I think, to overstate the impact. Just very, very little is happening in the hotel industry, in the convention industry, and in the overall sort of travel tourism, not surprisingly. As I heard from David Gilbert, the last 8 years, our leisure travel business was above the national average every year. Thousands of new jobs have been created in that industry. And this is a pretty unprecedented impact. You're going to see a cascading impact. When we bring in shows, when we bring in travelers, it has a lot of positive economic impact. When we don't, obviously, it's the opposite. From just the convention center impact as an example, or those who are having shows or promoting shows, they have to plan ahead. So they don't know exactly what to expect in June or July of this year. How far along will our process be and our response be? Just a lot that goes with that. Just something, an important thing to keep in mind. I would say uniformly, they are all talking about how to come out of it in the best way. What's the best strategy? How can we be most ready to come out of it when this ends? And it will. And that's something they're spending a lot of time being very strategic about. One other thing I heard yesterday I thought was encouraging is that local manufacturing sectors, as one example, are encouraging and having facilitated peer conversations. How are other manufacturers, other businesses handling this? And that's the kind of thing our local economic development partners are supporting. I would just flip, if you could, skip the conclusion slide if you don't mind, and I'll just end quickly on my last couple slides. There are the sources I have, the economic impact sources. You can see some of those things. I think Bloomberg is a good source, has a paywall. Obviously, I used a Morningstar report, some other local reports. The Barron's article is interesting. It's a take on some past recessions. Next slide, a couple of articles on stock impact, pension impact for a lot of state employees and other employees and state pension funds. State budget impact, those two articles really interesting. Some other areas of coverage. And then the last slide on health medical sources, I'll just direct your attention to the last two. Those two links are basically, if you want to know this data on a basically updated momentary basis, those two links show you constantly updated the number of cases in the United States. So the first one has a list of all the testing figures by state throughout the country. The last one is a Johns Hopkins website that shows globally and graphically the number of cases, where they exist, and some of the impacts. So if you want to put yourself with that kind of data, it's available to you. Just ending on the conclusion slide, going back if you could for a second, just wanted to point out one last I think important point, the need for volunteers in the community. We know that the food bank still has a great need for volunteers, and food bank and other entities, the Hunger Network of Greater Cleveland, for example, they rely on volunteers, and they are people that fall into the category of having a need that continues. And like things that government does, like things that other key entities do, those services have to continue. There are ways to help and also be safe and maintain social distancing. I think I would just say the need to provide these services is a fact. It's out there. Individuals have to make an individual choice. And there are ways, I believe, to be consistent with social distancing and to be safe and keep yourself safe and also support these organizations. Obviously, financially is a way to do that. But that's something just what I ask you to consider. I believe we're going to be meeting a communication about that later in the next day or two, just to encourage those opportunities for people. And then my email address is there at the bottom. I'm happy to hear from anybody who has a question, try to either answer it or get you the answer in some way. Thank you.
Matt, thank you for your comments. On the volunteerism piece of it, the CMBA is an organization that runs a number of different community programs that attract volunteers. We too have heard lots of demand, whether it's through the food bank, whether it's people who are trying to get access to the system, which we're going to talk about in a little bit. And the Bar Association is doing its part to try to pull together some resources so that those people who are looking for ways to give back right now can figure out how they can donate their time. I know that there continues to be some concern, which is why we're going to bring in Dr. Frank with respect to the health side of this conversation in terms of what's safe, what isn't safe. I think also in terms of a bigger picture about how people are responding in an appropriate way. You mentioned the phrase, Matt, is that the new buzzword everyone's using is social distancing. I read somewhere someone is advocating that we drop the word social and insert physical, because more than ever we need people to stay connected to each other because social distancing and isolation is really not good for us. So focus on physical. So at this point, let me turn it over to Dr. Scott Frank. Dr. Frank, thank you for joining us. Dr. Frank is the Director of Public Health Initiatives for the Case Western Reserve University School of Medicine. He was the founder of 20 years ago, as I understand it. Happy anniversary, you just celebrated. The Master of Public Health program at Case within the School of Medicine. In addition to being a member of the medical school's faculty, you have also served as the Director of Health for the Shaker of City Heights, where you also live, I understand, with your family. And of course, you have a long and distinguished career as a family physician affiliated with university hospitals. We appreciate your being here and look forward to your comments.
Thank you very much to you and the Bar Association for inviting me to participate in this panel. I'd like to start out with an apology to my public health colleagues for sitting in this chair today. I am not adequately socially, physically distanced, not quite 6 feet, and I'm not staying home, which we're urging everybody to do. Every precaution has been taken here, and I am happy to be here and contributing to the conversation. My comments today are oriented towards understanding public health's role in this process. Matt did a great job of kicking things off, and it's great to be on a panel with my friend who we shared health director designations together with for a number of years and worked closely together during that time. So great to be with you again, Matt. So I'm going to start out with the message, stay home, and then comment on the trouble with COVID. Apologies to the movie from 1955, Trouble with Harry. That movie, by the way, was the trouble with Harry in that movie was that he was dead. So our goal is not to be dead because of the trouble with COVID. Sticking with my cinematic theme, I'm going to start with my first point in the trouble with COVID, with apologies to the movie Aladdin. It's a whole new world. It is changed. It will forever be changed by this incident, just as the world was forever changed in 1918 by the Spanish influenza. And in some ways, those changes advanced medicine and society in very important ways. I expect that will be the case, but at that time it was not without great suffering, and in this instance, I suspect that will be the same. Nothing is happening that we in public health have not anticipated. We predicted this, we prepared for this, we're acting on this. In all honesty, we thought it would be avian influenza that was the novel viral agent that we would be coping with, but in fact, this is what public health is built for. The problem lies in civic will and political will and the willingness of decision makers to listen. We've had a contrast that many have noted with the outstanding job that's been done here in Ohio with Governor DeWine truly listening to our Doc Star, Ohio Department of Health Director Amy Acton, and the whole public health community rallying to give advice to Governor DeWine, which he has uniformly followed, making, from a public health perspective, correct decisions before others were making those decisions at every step of the way. You have all by now been introduced to the concept of flattening the curve, which is done through the social distancing, physical distancing, and other policy decisions that have closed everything from beauty salons, my mother's in mourning for that, to elections. So flattening curve is a real need and the best available mitigation strategy that we have. To reiterate what Matt said earlier, COVID-19 is a novel virus, meaning it's entirely an entirely new invention of nature, a product of what we refer to as genetic reassortment between animal and human viruses. And this phenomenon is known as antigenic shift. When antigenic shift occurs, it does create this novel virus. Many of those novel viruses, when they're created, aren't transmissible human to human. That's why avian influenza has been on the horizon for so long. It has never really crossed the Rubicon and become transmissible human to human, so it's really transmissible from birds to human, and those who've been exposed to poultry especially are the ones who have suffered from the avian influenza. COVID-19, on the other hand, unexpectedly jumped the shark and has placed us in a position of very acutely dealing with this novel virus. One of the other things that we don't know about COVID-19, and one of the troubles with COVID-19, is whether it will behave like seasonal influenza which also experiences antigenic drift, which is a more minor change in the antigenetic structure, the immunologic structure of the virus, that is the reason that we have to have a different seasonal influenza virus every year. There's a minor change that happens that is sufficient in its function so that every year we have a new seasonal influenza. The hope is that's not the case with COVID, and that one vaccine will be robust in preventing COVID once that vaccine is produced. You've heard estimates from 1 year to a year and a half. I won't be shocked if it happens a little bit sooner than that because of medical ingenuity, but we certainly can't count on it before that. The next trouble with COVID is that it's already apparent that it does not behave like other viruses humankind has encountered. The first of these points is that it is easily transmittable. Every case is thought to infect another 3 to 7 people, depending on the extent of isolation. And this is in part because of a long and variable incubation period, from 2 to 15 days. This is the period where the virus is transmissible before symptoms develop. The average incubation period is about 5 days. It's a little bit more than 5 days. And by 13 days, 98% will develop symptoms. But during that time, from 2 days to 13 days, the individuals with the infection may be transmitting it without awareness that they even have it. The next of our trouble with COVID issues is that it's transmissible both by respiratory droplets, which is the primary mode of transmission for seasonal influenza, but also through fecal shedding, which is to say, if we are not pristine in our hygiene following body elimination, the virus spreads in that way too, which is to say, it can be in food sources if food providers aren't pristine in their hygiene. It makes hand washing that much more important, and it already is a primary mode of prevention for all viral illness. The next of our unique features of COVID is that it persists on fomites, we call them in medicine, inanimate objects or anything that you may be able to touch for up to 9 days. 9 days, that's an incredibly long period of time for persistence of this virus. The usual persistence of fomites for other viral infections is 2 to 3 days. So this is 3 to 4 times longer persistence on fomite than we're generally accustomed to. The mortality rate is both age and population dependent, with very high rates for those at most risk and low rates for others. This provides a dilemma for those who don't, in fact, act in the best interest of populations, but in their own selfish interest in spreading the condition because they're not worried about the impact it will have on them. Risk is both based on age and medical conditions, and those with chronic medical conditions, as I'm sure all of you know, are at much higher risk both for development of COVID and for mortality from COVID. There's also substantial morbidity related to COVID with persistent decrease in lung function even after recovery from COVID that may alter health long-term for those who develop lung complications from COVID. In fact, the primary symptom that distinguishes COVID from other viruses is shortness of breath. The most common symptom is fever. There are very few people, and really none, who have serious cases of COVID who don't develop fevers. Cough is next on the list of most common symptoms, but it is shortness of breath that distinguishes it from other viral illnesses. It does not mean you have COVID if you have shortness of breath and a fever, but it does mean you need to be tested or to act as if you already have COVID. It is not unique to COVID, but the most vulnerable populations, including the poor and working poor, minority, and those with disabilities, are at the greatest risk for both developing the illness and dying from it. I'll add a characteristic of risk that we deal with in Cleveland, and that is the digital divide and the inability of people in certain neighborhoods to have access to broadband that will bring them the resources from home that those of us who are privileged experience. That will be especially amplified, as it is for everyone, with everybody on the internet at once now, which is probably why we had the complications in getting this presentation started. The last of my points here before going on to my next area is that Matt mentioned the book, The Great Influenza by John Barry, a great read. But I did want to point out the subtitle of that book, which I think Matt may have purposely avoided, The Story of the Deadliest Pandemic in History. The question really is, will COVID-19 replace that designation, or will we successfully mitigate to avoid that ignominious title? So, welcome to COVID-19. Stay home. Part of the dilemma that we face is that the primary motivation of human behavior is to maintain a perception of personal control. As such, our brain primitively processes whether a situation is controllable, uncontrollable, or of uncertain controllability. We cope pretty well when we believe something is controllable. It would seem like the most difficult situations are those that are out of our control, but often we're able to accept our lack of control, and our coping goes way up, our perceived stress levels go way down. Hence the serenity prayer, God grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. It is situations of control uncertainty that create the greatest stress, the most anxiety, and the most immense sense of ill-defined tension. Surreal is an accurate description, and welcome to COVID-19. Everything is uncertain about COVID-19, especially the degree which we can influence our own control over whether we develop the condition or not.
But Dr. Frank, I'm sorry to interrupt you, we actually received a question specific to that. If you do develop it, and maybe, I don't mean to cut you off, but we have a couple others that are going to speak. What does the trajectory look like? If somebody develops symptoms, what can they anticipate? How long will they be sick? What is the best course of action to take immediately?
So there's great variability in terms of how the illness affects people. Again, it depends on age group, on other medical conditions, disabilities, but the illness, when it is serious, progresses quite quickly, and fever, cough, shortness of breath occur once symptoms begin to develop within the first 3 days. It can be a prolonged course, lasting up to 21 days, but the most serious and life-threatening of the complications tend to occur within the first, we'll say, 3 to 5 days after symptoms first appear. So it looks like I'm rounding toward the end of my time, so let me just make a point that those who are arrogantly misinterpreting this pandemic as controllable, are people who are making reckless mistakes, endangering populations at the same time that they endanger themselves. Likewise, if we see it as uncontrollable, we may not take the precautions that give us our limited degree of controllability. So I urge you to please acknowledge the uncontrollability of pandemic COVID-19 and embrace it. Figuratively, I know we're not hugging, but to embrace uncertainty is to seek evolving knowledge, keep yourselves informed, to remain agile, change your behavior as recommended by the experts, to problem solve within your households, workplace, and families, and to avoid becoming overwhelmed as best we can. While COVID-19 should remain in our mind, it cannot be on our minds all the time if we want to avoid being disabled by uncertainty. We will be inundated. We don't have to become overwhelmed. Seeking serenity by way of wisdom, welcome to COVID-19. Stay home.
That's an easier said than done prescription to stay informed, to stay aware, to stay on top of it, and to not become obsessed with it. And I know it's something that all of us are struggling with. Matt gives sort of the global impact, the statewide impact, the national impact. I mean, those are overwhelming pieces of information that if people, I think, dwell too long, they'll go down a rabbit hole, as you've described, Doctor, and we'll have a tough time getting back. So one of the organizations that I know is working really hard and has been for some time in trying to bring clarity and finding the right balance between protecting public health, but also ensuring that the wheels of justice continue to turn where they need to, is the Cuyahoga County Court of Common Pleas. At this point, I would like to introduce Andrea Canast. Andrea, thank you for being here today. Since 2015, Andrea has served as the Deputy Court Administrator and the Director of Court Operations. In this role, she works to uphold the court's mission to serve a forum for the fair, impartial, and timely resolution of civil and criminal cases. She's done lots of other things, but what I'd really like to get to is what I understand has been your incredibly instrumental role in helping the leadership of the court under Administrative Judge Brendan Sheehan and others to really drive things forward. So if you could please, Andrea, tell us what's happening in Common Pleas and what does our community need to know?
Yeah, thank you, Becky, and thanks to the CMBA for having me here today. So in thinking about my remarks today and what I might focus on, really, we have been taking this one day at a time. And just to touch on something that Dr. Frank said and people being agile, that's not always something that the courts are known for, I will say. And that's a good thing, actually. That's a good thing for the community, that the courts don't always make swift and rash decisions. However, in this time, we have had to make decisive action in the court in order to continue to protect the community and public safety. And so working with our administrative and presiding judge, Brendan Sheehan, just to take you sort of step by step what we have gone through. On March the 6th, the courts in Cuyahoga County, including the Common Pleas, all of the divisions of the Common Pleas courts, Cleveland Municipal Court, and the 8th District Court of Appeals, we worked to put out a public statement regarding court operations as this was slowly starting to emerge for us. And the message at that time was, the courts are open, we're here, our business remains the same. Don't panic, right? Wash your hands, practice good hygiene, and that's where we started. And I think that's where we all hoped we might stay. Of course, as we progressed into the next week of March, then things changed dramatically. And so I give great credit to Metro Health Medical Center and their doctors there for reaching out to the court on March the 10th, Tuesday, March the 10th. And at that time, we sat down with Dr. Bruner from Metro Health Medical Center, and we talked about the jail, Cuyahoga County Jail, and her concerns if this virus reached the county jail. And really, within a matter of time in our discussions, it wasn't a if it reached the jail, but a when it reached the jail. And so at that point in time, again, working with Judge Sheehan, we really knew that we had to take swift and dramatic action and really start to focus on our jail population. As of last week, last Wednesday or Thursday, our jail population was around 1,978 people. As of today, the jail population for the county is at 1,321. And how we accomplish that is all of the stakeholders in Cuyahoga County working together. Starting last Wednesday, we put together a plan with Public Defender Mark Stanton, Prosecutor Michael O'Malley and his staff, and our judges, and we really sat down and started to look at what we could do to expedite cases through the criminal justice system. This does not mean that we're treating those cases any differently than they would have been treated 1 month from now or 3 months from now. It just means that we have really, for all intents and purposes, stopped a lot of our other business and focused with a laser-like intensity on the jail. And it's through the efforts of all of the judges in the county, including our Cleveland Municipal Court and our other suburban judges throughout the county, and their help as well in trying to reduce the jail population. So we went into Wednesday, March 11th. We had a regular judges meeting scheduled. At that time, we sort of came to a decision about how we would continue to operate on somewhat of a reduced staffing plan. We also put into place this idea with Prosecutor O'Malley and Public Defender Stanton to really provide some intense criminal case review days for each of the judges in the Common Pleas Court over this week. We left that meeting, I think, feeling fairly confident about the plan that we had in place, and really starting to put it into action. And then, of course, I think it was the 12th when Governor DeWine made the decision to close the schools for the next 3 weeks. And that sort of, again, changed things dramatically for all of the courts. All of the courts, we rely on a wonderful staff coming in every day, and certainly childcare and schools being closed creates an issue for our staff. And so we, again, acted very quickly to implement a reduced staffing plan for the next 3 weeks so that we could those people that needed to be home with their kids and work out childcare issues, we could do that. And we were still getting guidance at that time from the Supreme Court of Ohio and Chief Justice Maureen O'Connor, and the message being that the courts do not close. We exist for the citizens of this state and the citizens of Cuyahoga County. And so the courts were not closing. To that end, we did want to, again, focus on the safety of our staff and the community. And we started making some decisions that on any other day would have been somewhat of a seismic shift for the court. We suspended all of our jury trials. Only those that would have had a constitutional speedy trial issue we said would go forward. We converted our jury system into a call-in system. And again, like I say, that one decision alone would have been a huge decision 3 months ago. Today, it's a decision that we make, and we have to move on and try to implement a best process to see that through. So we've been getting guidance from the National Center for State Courts located in Williamsburg, Virginia, and the Supreme Court, and again, trying to work through this the best way that we could. Focusing all of our efforts on our incarcerated jail population. On Monday, the 16th, this past Monday, we called an emergency judges meeting And at that time, we decided to put out a administrative order declaring a judicial emergency. And that gave us some greater flexibility to suspend our local rules, suspend the policies of our employee handbook, our security plan, and gave the judges of the court some greater flexibility to, again, continue to focus on our jail population and on criminal cases that had a speedy trial issue. Over the past couple of days, things, again, still continuing to change. Just yesterday, the Attorney General Dave Yost issued an opinion related to tolling of time. This opinion was incredibly helpful for the courts and really for all of the stakeholders in the justice system. We're hearing from attorneys. We could not be doing this without our public defender's office and without our assigned counsel who are meeting with clients every day, needing to go into the jail to meet with clients, and we're worried about their safety as well. And so this ability to toll time on our cases gives everybody a little bit of an opportunity to take a breather, step back, evaluate cases. Again, those cases that are incarcerated individuals, we will continue to see. Over the next couple of days, we are still continuing to put plans into place so that we can further limit our operations. Again, the message is that the court is open. Any emergency matters before the court, we have plans set in place so that we can continue to hear those. Our arraignment room will continue to stay open, processing jail cases so that we can continue to try and divert as many people from the jail as possible. I want to put back an emphasis on the fact that while we are doing this, the safety of the community, both in terms of a health safety and a safety in terms of future criminal activity, we are keeping that in mind. The decisions that our judges are making right now are ones that they would make at any time, but because we've suspended a lot of other business, we're really able to focus on our incarcerated population. Thank you.
So I think one of the biggest challenges that we've been experiencing across the state is the inconsistency that different courts, different courtrooms, different judges, et cetera. Just this morning we learned, in fact I was just checking to make sure it's still happening, that Chief Justice Maureen O'Connor is joining the governor's briefing at 2 o'clock today to talk about from the Supreme Court's level on down what their expectations are. Is the Common Pleas Court aware of what's coming out at 2 o'clock, and is it consistent with the actions that you've already taken, or is it a wait and see what she says at 2 o'clock?
Yeah, it is a little bit of a wait and see what she says at 2 o'clock. There may be some out there that are privy to the remarks that she's going to make. I am not one of those people, so we will see.
Fair enough. I will say that one of the things that we've been talking about, the CMBA has been talking about, and others have been, is about finding a way for there to be a central repository of some place, somewhere, in order to capture all of these different orders that are being issued by the various different courts. I know that the Supreme Court has been working closely with the Ohio State Bar Association to come up with something. I think the OSBA sent something out today that talked about their resource directory, but I think that's still something that's yet to grow, to develop. Andrew, is the Court of Common Pleas, do you all have somewhere consistent where you're posting each of the divisions, orders, anything that comes into the future to simplify this process for people to get information?
Yeah, so we have been posting everything to our website. All of the divisions of the court, so juvenile court, probate court, domestic relations court, and including the Cleveland Municipal Court and 8th District Court of Appeals. All of the courts have been using their websites as a place to post information about any new orders or maybe processes that are being implemented. And so anybody could go to our court website, cp.cuyahogacounty.us, to get all of that information. But we have been trying to make certain that we are communicating with the public in a good way.
Right, right. Well, one of the people whose phones I assume has been ringing off the hook is Rob Gilmore, who's joining us from Corman, Jackson, and Krantz. Rob serves as the chair of the Labor and Employment Law Practice Group and leads the firm's employment and severance negotiations practice. In his own practice, he counsels employers, both large and small, in the full range of labor and employment matters. He represents employers across virtually every tribunal that exists. And prior to joining Corman, Jackson, Krantz, he was an assistant general counsel for Verizon, which gives an interesting business perspective to the day-to-day law practice that you have. And Rob, I appreciate your willingness to be here to help us talk through some of the myriad of questions that are coming out about what's happening with employers, what's happening with employees, and, oh, by the way, some brand new acts that out there with new acronyms for us to learn that are impacting what's happening. So I'll turn it over to you, Rob.
Thank you very much, Becky, and thank you to the Bar Association. Yeah, the phones have been really off the hook because really every employer, large and small, is trying to figure out what to do in these circumstances. And so employment law issues are very much front and center right now. So, and as Becky said, there is a new federal law hot off the presses that the president signed late last night. So I'll spend some time today going through some of the key takeaways from that bill. There was a lot of back and forth over the week from a bill from the House that went to the Senate and back and forth. We now have a signed bill that is law. Some people wanted more in it, some wanted less, some wanted more protections for employees, some wanted more protections for business. This is, I think, a very good start to help employees, and there are some protections in there for businesses on the back end in terms of some of these new mandates for payments that need to be made. I expect there'll be more. I don't think this is the end of legislation coming from Washington on this issue, so I think we're gonna see more come in. But I'll spend a little bit of time today going through the takeaways from this new federal law, the Families First Act, that we're all still reading this morning. I'll also go over some changes in Ohio law, specifically unemployment, that has been expanded based on the situation that we're in. And as well, I'll go through some of the frequently asked questions that I'm getting. As Becky said, literally all day, every day, I've been on the phone with employers, large and small, talking about, what can you do and what can't you do under the law, under the new law, but also what should you do from a business standpoint. It's not simply, what does the law provide? That's certainly the starting point. What's the right thing to do from a business perspective for your employees, for the HR, for morale? All of those issues are coming into play. And so I'll spend a little bit of time going through what I have found to be the most frequently asked questions over the past 3 to 5 days. Moving into the slides, again, I'll start with the new bill, which is the Families First Coronavirus Response Act. So in general, again, it was signed last night. There's two main provisions, at least from the employer-employee perspective, that I'm going to talk about. The first is a major revision to the Family Medical Leave Act, and the second is a completely new emergency paid sick leave provision. So we'll go through both of those. They're going to be both effective April the 2nd. It's 15 days from the signature of the bill, which was last night. So it will come into it will be active and effective on employers who are covered, and we'll go through who those are as of April the 2nd, but employers are going to need to start planning for that immediately, getting policies out, letting people know what this is and what it's going to provide. And at this point, at least, these will sunset and be done as of December the 31st of this year. But of course, we'll see what happens there. Starting with the FMLA expansion. So going to the next slide. So a covered employer is very different than a covered employer under the FMLA generally. So if you're familiar with the FMLA, it's 50 employees you need to have to be covered by the FMLA. And if below 50, you've never been covered by the FMLA. This is completely different for the narrow circumstance that we're going to talk about. A covered employer now is all employers with less than 500 employees. So small businesses, on down to the smallest business, will likely be covered, or at least will be covered by this act, although I will tell you there are some statements in there that employers with less than 50 employees have the ability to seek an exemption from the Secretary of Labor. But really, right now, there's no regulations to that, and so you can't necessarily count on that. There is a provision that allows very small businesses under 50 to seek an exemption. But as we sit here today, I think you have to assume that you may end up being covered. Also, it's very different what a covered employee is. If you're familiar with the FMLA, generally, you need to have worked for a year, for 12 months, and have 1,250 hours to be an eligible employee, or you're not covered. This broad expansion, as long as you've worked for a company for at least 30 days, you are covered. So very different coverage there. Employers have a duty to notify employees, and there'll be some, I believe there's going to be a poster coming out from the government that'll be posted. I don't think it's out yet, but it'll be on the way. As we move on, again, what is leave covered for? This was one of the big changes between the House version and the Senate version. And initially, this was going to be a greater expansion of what the eligibility requirements are for FMLA, and was going to provide many more people with the ability to get this coverage. As it was changed and as it has now been passed, it is more limited. It only applies if an employee is unable to work or telework because they must comply with a quarantine or a self-quarantine, or they must care for a child home due to the coronavirus. So it's only going to really apply in childcare situation. If you're a person who, for many different reasons, I have to stay home, my child's school is closed, or the childcare is closed, or the person who normally watches my child can't do that, I am forced to be home, and I can't work. Now, some people will be able to telework, and then this wouldn't necessarily apply. They'd be able to keep working, and that's fine. But if they're not able to work, they're in a job that says, I can't work from home, so I'm stuck home and I cannot work. This law, again, if the employer is covered, if the employee is a covered employee, then this law would apply to provide some benefits. And so what does it do? It provides that the first 10 days of this leave, so really 2 weeks, are unpaid, and then the remainder up to 12 weeks. So it's still 12 weeks like the FMLA always has been. The other 10 weeks would be paid, and I'll get into that. Now, one thing that's important is for employees, the first 10 days where I say it's unpaid, an employee may be able to utilize already their paid time off, their PTO, their sick leave, their vacation. They may be able to do that so that they can get some of that covered. And as well, when I get to the second piece of the new law, which is the paid sick leave, that's one of the categories that provides for 2 weeks of paid sick leave. So if somebody qualifies for both this family leave extension and the paid sick leave, they may be able to they're allowed to use that paid time to cover this first 2 weeks, 10 days of unpaid. And then following the first 10 days, up to the next 10 weeks, or whenever the situation mitigates itself and the person is able to go back to work, the kids can go back to school, the pay will be at 2/3 of their regular rate of pay. But there's also a cap. This is where I talked about, businesses having some protections here on the amount of money that's going to be paid. So it's capped at $200 a day and $10,000 in the aggregate over the time period. And if it gets to a point where you've gone beyond the $10,000 and you're still within the 12 weeks, the rest of it is unpaid. And again, there were fights back and forth leading up to this, but this is, again, the law that exists now. Again, I wouldn't be shocked if there's going to be some changes. Moving on to the next slide, like the FMLA, there is a return to work obligation for most situations where an employer is going to have to give you your job back or an equivalent job. The only exception is if you have less than 25 employees. Again, there's an opportunity to try to to seek an exemption to this, or to say, look, I'm too small. This is going to be a business jeopardy for me. The job doesn't exist anymore because of the disruption for the economy. So 25 may or may not have to comply with the job return. You can't just say, no, I'm not going to give you a job back. You have to try to do it. And in fact, you may have to try for up to a year, frankly, to see if you can.
Interrupt you, but I got to say, so this sounds complicated.
It's very complicated.
And it's going to take effect April 2nd.
Yes.
And so employers are going to be scrambling between now and April 2nd to figure out what they have to do and can do. Employees are saying, I don't care if it's 2/3, all I know is I can't go to work for these variety of reasons. Are you envisioning from a process standpoint, because this will be months in the figuring out all of these details? Yeah. What do you think that employers, particularly small employers who are of limited resources already, what's their best bet for how to begin to tackle these nuances and to make it real by April 2nd?
Yeah, there's a number of things that that employers are looking at. Some employers are saying, you know what, based on the economic uncertainty right now, I'm going to lay off employees. I'm going to go to a short-term layoff. And if that were to occur, again, we're going to get to the second piece of the paid sick leave that may apply if it falls within there. But then it also, your question brings up the expansion to the Ohio unemployment laws. So that has opened, the doors have been opened more to get unemployment right away. In a situation where, because of the COVID-19 situation, somebody is unable to work. Either they've been told to stay home, they've self-quarantined because of the situation, any number of these things. The governor issued an executive order that has expanded unemployment. It's also taken away the 1-week waiting period so that you can get right to it, and you don't have to be looking for a job as you normally would in unemployment. So, some employers are saying, I'm going to lay off temporarily right away and get people immediately onto unemployment. Other employers are looking at it and saying, let's do the best we can to see if people can telework and get as much done as possible. Some employers are talking about, doing across the board pay cuts and seeing if they can sort of mitigate the time period here and deal with some reductions on the payroll. So there's many different things that are being considered, and some of the FAQs that I've got towards the end of the slides are dealing with that.
And so for the employee, a lot of the folks I think that are going to be watching us are people who are thinking not as lawyers, but thinking as employees and or as business owners. And so some of those best sort of resources, and maybe this is in your FAQ later, you would direct employees to what, to where? To the Ohio, to look at unemployment benefits. They could get all of that information online, what the process is for how they would go about applying?
Yeah, they can certainly go and check the Ohio unemployment rules that are out there. There's a lot of articles that have been written to summarize those. I've got a slide in here that summarizes. It's important to get your arms around this new Families First bill, because that's going to make significant changes if you're an employer deciding, what am I going to do if I do this? Is that going to trip this wire and provide a certain amount of pay? How do I factor that in? So you need to figure out the federal law changes, the Ohio law changes, and then you've got to look at your business and decide what you can do to stay to stay afloat, to have people working as best as possible during this time frame, and think about what's best for the business, but also for your employees, because this is going to end. And I say to companies, you've got to look at both the bottom line and how you're going to deal with this, but you've also got to realize at the end of this, your employees are going to look at you and determine how did you act during this crisis. And you want to try to have a holistic approach to we're trying to do the right thing with many different competing variables, and it's certainly not easy.
And that, I will say, is the position as the CMBA. We're an employer of 22 individuals plus part-timers, and where we started is doing right by people in hopes that when we get through this, on the other end of it, our people are in as good a shape as possible so that we can carry on the business of the bar.
Absolutely.
So it sounds like, Rob, we ought to think about doing additional conversation in the future to give some additional resources and help to try to sort through this between now and April 2nd. And meanwhile, sitting next to you is Daryl Clay, who is a partner with the law firm of Walter Haverfield. We were calling Daryl our cleanup guy because he does, in his day-to-day practice as a lawyer at Walter Haverfield, he handles both civil and white-collar criminal disputes across a myriad of different areas. And I know, Daryl, that you, too, have been seeing your phone and your email blowing up with people with questions, not unlike when you were president of the CMBA a few years ago, although different types of questions at that time. But, Daryl, we're hoping you could sort of jump in and sort of hit a couple of the hot spots that you're seeing.
Thank you, Becky. I want to thanks to the Bar Association, thanks to our guests for this follow-on Hot Talk. I was sitting in my office last Tuesday watching the original Hot Talk on the coronavirus with a modest degree of interest, but perhaps, like many people, still in a state of denial of this is going to temper down, this is going to settle down, and here we are 9 days later, and the landscape has changed. And the only thing in my life that even comes modestly close to approaching what we're seeing as practicing lawyers, with tons of complex issues being thrust upon us literally overnight, was when the city of New Orleans flooded in 2005. And all of the things that had to be dealt with, certainly difficult because of the destruction of all of the critical infrastructure at that time. We're not yet having to deal with things like that. But literally the sort of overused, and I'll probably use it myself later on, the tsunami or the tidal wave of things that we've got to unravel with not a lot of guidance, or literally with the rules changing. You put your head down to sleep and it's one set of rules. You wake up, it's another set of rules. By the time folks may see this, there's another press conference with the governor at 2 o'clock today. Some of the things that we talk about here may have changed once again. So it's important as practicing lawyers that we keep our ears to the ground, and while we're trying to answer questions, we're trying to stay educated. And I see all of us up here today have continued to sort of remain plugged in. Typically not an appropriate thing to do when you're on a panel. You pay attention to what's going on. But as I've been sitting here, more questions have been coming into my inbox, even including about the Families First Coronavirus Response Act. I think we've been very fortunate in the state of Ohio that our governor and our director of public health have been out in front and didn't really worry about maybe the political or other consequences of these mass orders that have been issued, but really are making decisions based upon scientific evidence and what is in the best interest of public health. And we're all just going to kind of have to figure it out. One of the first things that sort of started appearing in my inbox last week was just basic contract issues. Folks, you go to law school and you read about force majeure, a big fancy word saying some event that has happened that makes it impossible to perform under a contract. And the question was, is the coronavirus a force majeure event? And where we come down on this issue, or at least where I come down on this issue, is maybe the lawyer's favorite answer and the client's least favorite answer is it depends. Law is a profession of words. Words matter, and the words of your contract will matter in determining whether or not COVID-19 and the coronavirus constitute a force majeure event. If, for example, your contract clause specifically talks about public health related events, things like flu epidemic, serious illness, plagues, disease, emergency outbreaks, you might have a pretty good argument that force majeure applies. On the other hand, if perhaps your lawyer more narrowly drafted your force majeure clause and only focused on many of the typical things that are also in a clause, strikes, riots, war, terrorism, or natural disaster, your force majeure clause may not come into play. The best thing you could hope for is that maybe it says, or any other cause whatsoever. That's typically broad enough language that no matter what specific events were included, that notion that anything that is out of the complete control of both parties can excuse performance under the contract may be helpful. And this isn't just an issue for sophisticated businesses who have negotiated contracts at arm's length over an extended period of time. This really flows to every area of life. Landlords and tenants, businesses and commercial tenants. Is there a force majeure event that causes an interruption in rent payments? Restaurants and vendor suppliers, look at the standard terms on a purchase order. Is there a force majeure clause? It's going to be all over the place. Ohio doesn't have a single specific definition of force majeure, but it does say that if you are trying to excuse your non-performance under a contract under force majeure, the event has to be beyond your control and without your fault or negligence. So I don't think anyone's going to have a problem proving COVID-19 wasn't your fault and it was outside of your control. On the other hand, there is other case law in the state of Ohio that says things about force majeure like this. Mistaken assumptions about future events or worsening economic conditions do not qualify as force majeure events. So it will be very interesting to see how our courts in Ohio ultimately deal with the practical problems that are going to flow from this rapidly changing landscape in Ohio. You want to certainly look at insurance policies as you encounter these issues. Do you have a business interruption policy? Do you have a rent interruption policy? Do you have short-term disability, long-term disability? That may come into play as well in terms of an employee who has to take a leave, maybe because they're not caring for someone else, but they've contracted COVID. And are they going to qualify for a short-term, long-term disability? The sort of second wave of the tsunami came last week with the governor's announcement with Dr. Acton, I think you called her the doc star, about the closing of school districts. And we have a very extensive education practice at our firm. And so immediately districts were asking very hard questions about what does all this mean? It was originally called an extended spring break. Well, that may mean one thing under contracts with unions. A closing of schools for a public health emergency may mean something very different. So we've spent a lot of time trying to sort out those questions and what they mean. And regrettably, this is a time where we're trying to give informed judgment, but frankly, there are as many questions as there are hard answers right now. And I don't know any lawyer that really enjoys being in that hot seat of saying, well, the answer might be this, but it might be that. Another issue that we've had to deal with, and frankly, the Attorney General has helped on that, is not just our public school district clients, but all of our public entity clients, compliance with the Open Meetings Act. How do you deal with the Open Meetings Act when you have an order from the Director of Health saying no mass gatherings? And we don't have provisions in the Open Meetings Act right now that fully embrace rapidly evolving modern technologies, Zoom meetings or Google Hangouts or things like that. Fortunately, on March 13th, the Attorney General issued a letter indicating that live streaming of public meetings may achieve compliance with the Open Meetings Act. But a couple of days later, he indicated, now that's not a formal legal opinion, but I'll support any public body that ultimately encounters a challenge under the Open Meetings Act if you did live stream. That same day, Representative Lisa Sobecki of Toledo introduced House Bill 557, which specifically says that in the event of a declaration of a public health emergency in the state of Ohio, that members of a public body may attend meetings by means of a teleconference or video conference, but they must make provisions for public attendance at a location that's involved in the teleconference or video conference. So again, we're trying to tell people to stay home and avoid mass gatherings, and we're going to allow the public officials to participate by remote means. But if you, the common citizen, want to go to your town council meeting or to your local school board meeting and raise a concern, are you going to be forced now to go out into public and expose yourself to health risks? So there's more work to be done here thinking about this. And to me, yet another question is, well, if you're live streaming, are you now creating a public record, and you need to somehow ensure that a copy of that Zoom meeting is preserved? And I don't know if Zoom automatically does that. We can all put...
The answer to that question, it's not automatic, but it is a feature you can choose.
Well, that's...
And clearly, Facebook Live may or may not be a reliable source when streaming.
Well, again, that's something else to be thinking about as a public official. What are your obligations to ensure compliance with the Open Meetings Act and the Public Records Act? Just a couple of more things, and Rob was talking about Families First. The Emergency Family Medical Leave Extension Act, yet another acronym for us to learn. But there are many other laws that come into play as we deal with this. They include the ADA, the FLSA, HIPAA, GINA, which I had not heard of, the Genetic Information Non-Discrimination Act, OSHA, the National Labor Relations Act, and I've even heard, I was on a teleconference yesterday, where ERISA might come into play. So as lawyers, we've got to really think broadly about what are the legal implications of a particular course of conduct. And yesterday, the one that was blowing up our email boxes was the governor's statement that he wanted employers to take the temperature of all employees before the employees come to work. And literally 2 hours before, I was on a telephone conference where someone was saying this would be not a good idea because of issues under the ADA. There are lots of reasons why you might have a fever that have nothing to do with COVID and that trigger disability issues under the ADA. Just a couple of other really more comments for me to make. We're seeing the courts grappling with closures, the need to continue to pay attention to criminal defendants' speedy trial rights. One of the unique parts of life in Ohio is our judiciary system is not integrated. There are 88 counties, so there are basically 88 kind of separate judicial systems. Certainly at a personal level, I'm hoping that Chief Justice O'Connor, when she speaks with the governor this afternoon, may be able to kind of forge people to move towards kind of a unitary treatment of how these issues are. But even if the legislature passes some law that says deadlines that occurred during the declaration of public health emergency in the state of Ohio are told, what impact is that going to have on home rule municipalities? That if you're trying to pursue an appeal of an administrative board decision, they've got their own filing deadlines. I tried to file something with a local government this week and City Hall's closed up. So what do we do to try to meet our deadline there? Again, as we were sitting here, we got an email from the Ohio Bar Liability Insurance Company that basically was urging lawyers, stop waiting. Many lawyers are notorious for being procrastinators and simply saying, stop procrastinating. If you have something that's on your desk that needs to be filed, go ahead and do it now. Courts are still accepting electronic filings. Go ahead and do that. Don't wait, don't wait, don't wait.
Speaking of deadlines, I hate to interrupt you, Daryl, but I'm going to need to. Because of our technical difficulties at the beginning of this panel, we had to sort of start and restart. My apologies for that. But we have more than exceeded our time that I promised I would let everybody get back to their day jobs so that you can deal with the crises that are coming in moment by moment. I want you to know that we will post this video both on Facebook as well as our YouTube channel. Complete slides, including Rob. I know you had a lot more information to share. Your full slides will be available, and I would love to talk to you about additional opportunity to get that information into the hands of people who need it. We had hoped to take lots of questions. That obviously didn't happen, but I would invite, if you have follow-on questions, if there are topics that you would like us to continue to have conversation about, please send them to our attention. We will continue to find opportunities to create dialogue and opportunity for future programs, hopefully that will be streamed live so we can take your questions and comments as we go. I offer my extended thanks to the panel for joining us and for practicing some physical distance, even if we didn't make the exact 6 feet. But we appreciate your being here. And at the end of the day, my hope is that for all of us, everyone takes the appropriate precautions to keep themselves and their families safe. Thank you for joining us.
Thank you.
Thank you. Thank you all. Dr. Frank, I'm sorry.